Hello, Miss Brown. I asked you to come in today to discuss Paris and how she is dealing with ADHD. Hopefully I can give you some helpful information.
Thank you, Dr. Phil. I have Paris, my daughter, who has been recently diagnosed here on Skype on my phone. Can you tell us what exactly ADHD is?
ADHD, Attention Deficit Hyperactivity Disorder, is characterized in the DSM by consistent patterns of inattention and or hyperactivity impulsivity. The symptoms must be more than usual for other children around their age and be present before the age of 7. The symptoms cannot be present only during the course of another mental disorder. Symptoms must be present for at least 6 months. To be diagnosed, symptoms have to interfere with functioning in at least 2 settings.
2 settings.
Yes, like school and church. Or home and work. In what setting do you recognize your symptoms, Paris? There are 3 subtypes. Predominantly inattentive, predominantly hyperactive impulsive, and combination. Characteristics of the inattentive subtype are difficulty maintaining attention to tasks, not paying attention to detail, being easily distracted, often forgetful and losing things, and having difficulty with organization. Characteristics of the hyperactivity subtype include fidgeting, often interrupting, having difficulty doing leisurely activities, running and moving in situation when it is not appropriate, and being very active. What symptoms have you seen, Paris? How does this affect your daily life?
So is this common? Who is likely to have this disorder?
ADHD is the most common childhood developmental disability. It affects about 8 to 10% of children from between the ages of 6 and 12 years old. Also, males are more often diagnosed than females, 2 or 3 to 1.
Why are so many more boys diagnosed?
A study by a group of doctors from the Pediatric Psychopharmacology Unit of Massachusetts General Hospital found that girls with ADHD are most likely to have the inattentive subtype, and less likely to have problems in school or learning disabilities. Boys were more likely than girls to have comorbid conduct disorder or oppositional defiant disorder. Boys having more outwardly apparent impairments could lead to more referrals and diagnosis.
So will she grow out of this?
Out of the 8 to 10% of children with ADHD, around 60% of these will carry on to adolescence, which Paris is near now, and 4 to 5% will carry on into adulthood. So she is likely to have it during her teen years, but less likely during adulthood.
What causes ADHD?
Exact causes are unknown. There are neurologic, genetic, and environmental factors. How genes play a role is unknown, but if a parent or both parents have ADHD, their child is more likely to have it. It has been shown to run in families. Dopamine, in the frontal lobe, is a neurotransmitter that carries and controls signals and information between parts of the brain. It focuses on relevant stimuli and depresses distractors, which affects what you pay attention to. Dopamine deficiency, or hypodopaminergia, affects other executive functions also, involving memory, sleep, attention, learning, and mood.
What about environmental factors?
Head injuries to the frontal lobe increase risk. According to a study done by Anita Thapar and other doctors, maternal smoking during pregnancy can increase risks. However, studies similar to one done by Sarah W. Ball say there is not correlation. Maternal drinking during pregnancy, lead exposure, and pesticide exposure are possible causes, being studied.
So what keeps this disorder going?
Maintaining factors can be low self-efficacy for tasks, poor coping strategies, under-arousal, high levels of stress, and low levels of support.
What about comorbid disorders?
About 60 to 80% of cases are comorbid with another disorder. The most common, in order, are oppositional defiant disorder, language disorders, substance use disorders, anxiety, learning disabilities, mood disorders, and conduct disorders. In a study by Catherine Humphreys and Steve Lee, children with ADHD and ODD had more risk-taking behavior than usual.
What are our treatment options?
Well, there is behavioral treatment and medicinal treatment. Often patients will be treated with methylphenidates and dexmethylphenidates, which are psychostimulants. These affect the balance of serotonin and dopamine, increasing attention and impulsivity control. Ritalin, Focalin, and Concerta are examples. Amphetamine and dextroamphetamine act similarly but affect norepinephrine. Adderall is an example. Vyvanse is a psychostimulant, but it was made to release stimulants slowly into the body. Lastly, Strattera or atomoxetine is the only non-stimulant that works by increasing norepinephrine and attention parts of the brain. Stimulants work by increasing the effectiveness and availability of neurotransmitters that help with hyperactivity, impulsivity, and inattention.
Are there side effects?
Stomachache and difficulty sleeping, loss of appetite affects about 80% of patients. Paris, what was your experience with medicines?
What else helps?
Behavioral therapy. This involves creating a daily schedule for school and home that helps establish a routine and what the expectations are, as far as homework and play times. Organization is also key. School notebooks and other items need to have a place to avoid losing track of things. School binder. Organization is also important so that the child can keep up with their own things at home and school, especially when assignments or notebooks are expected to be found quickly. Some things you can do are play sports, use highlighters for studying in organization, play with Play-Doh for example in your hand while focusing, or if you feel fidgety, and use a checklist when you have multiple things to do. Mom, you can also help. Pay attention to good behavior and consistently reward it. Make clearer rules, expectations, and consequences. Saying good job can increase confidence and self-efficacy. What has helped you, Paris?
Is there anything else?
Some alternative methods being studied are megavitamins, allergy treatment, and eye training, but none of these have been proven, so I would not recommend them. That sums it up. Hopefully you can implement some of my advice to help you, Paris. With a little help, it is definitely possible for you to be focused and more organized. Have a nice day. Bye.